Production support for In Focus is provided by Smithville, a locally owned business serving central and southern Indiana since 1922, with residential and business internet, voice, and security services. Smithville, local pride, global technology. Information at smithville.net. And by viewers like you. Thank you.
According to the National Alliance to End Homelessness, on any given night, approximately 750,000 men, women, and children are homeless in the United States. The U.S. Census Bureau reports 12% of Hoosiers live below the poverty line. Find out what government agencies and nonprofits are doing to help Hoosiers in need as we put poverty and homelessness in focus. Welcome to our final In Focus of 2009. I'm Ann Shea. Tonight we discuss concerns about poverty and homelessness, so give us a call or an email. Currently, social services are serving more people with less funds. This year, people all over the country have experienced hardships, with many citizens suffering from job loss, health insurance difficulties, and the loss of their homes. State programs have joined the fight against poverty and homelessness, and here's more on programs and individuals who are trying to make a difference.
According to the National Alliance to End Homelessness, between 2.5 and 3.5 million people live either on the streets or in emergency shelters in the United States, including hundreds of thousands of Hoosiers. And some agencies serving the homeless aren't finding wide support.
Largest concern is probably the inability to easily access services for the client and for other providers. We need access to the information that they hold easily and quickly, and obviously our clients need access to services easily and quickly, and that has not been the case since the changes with FSSA at the state level.
Monroe County, as a surprise to many, has the highest poverty rate in Indiana at this point. It's at 26%, according to the last Census Bureau survey. That's phenomenal. We don't want to believe that, given we're such a beautiful town, a university town, but there's certainly a large percentage of our population that are struggling. And certainly, as is the case all over the country with the downturn in the economy over the past year, you know, more and more people now are having a hard time making ends meet. So the work of all the agencies that comprise the local social safety net is even more important than ever.
Federal guidelines define poverty for a family of 4 as a household income of $22,050 or less. While Indiana's cost of living is lower than the national average, Rekas says families in poverty can't even afford the state's relatively low rates for food and housing.
It means an individual or a family has insufficient resources to pay for the basic necessities of life, and those necessities include food, housing, health care, for families with children, child care, transportation. People slip into poverty and find themselves in difficulty when there's an upset to that equilibrium. We serve 7,000 meals in that breakfast and lunch period every day, and we will have served over 80,000 meals when we get to the end of 2009.
I believe the new statistics are about 63% of the newly homeless are families, and that's a scary number. And that maybe they won't be homeless for a long time. They're not chronically homeless, perhaps.
Tonight, we discuss what programs are trying to assist impoverished individuals and the role of government agencies as we put poverty and homelessness in focus.
And helping me is WFIU's news director, Stan Jastrzebski, and he's joining us from the WFIU radio booth. Stan, give us a brief preview of who you will be talking with tonight.
And later on, we'll talk here in studio with Bill Ferry. He's a local advocate for the homeless. We'll ask him what more can be done to ensure that everybody has a roof over their head. That comes up in just a few minutes. Right now, though, back to you. Thanks
a lot, Stan. Well, according to the Family and Social Services Administration, the state of Indiana spends more than $100 million on food stamps every month. With Governor Daniels recently canceling the IBM Corporation contract, many agencies are asking the question, what's next? Well, starting off our discussion this evening with the issue of temporary Temporary Assistance for Families in Need is our panel. Dan Combs, Perry Township Trustee. Jennifer Osterholt, Executive Director of Bloomington Housing Authority. And from Family and Social Services Administration from the state of Indiana, Marcus Barlow, Communications Director. Thank you so much for being here. Why don't we go ahead and start with you, Marcus, and the current state of FSSA and what's happening now with the cancellation of IBM.
Well, as you said before, the governor recently made a decision to cancel the IBM contract. What we're moving forward with, and we're going to announce more about it in December, is a hybrid system. We've learned a lot of lessons over the past couple of years in what we tried to do, and the conclusion that was made was that the system that IBM tried to put in place was flawed. It was failed. They tried to break people into tasks rather than looking at someone as an individual. And so the system that we're moving towards will kind of put that, what was a good quality of the old system prior to modernization, but then keep all of the improvements we've made as far as technology and being able to better leverage our employees, because over the past 3 years our volume has increased by 24%, and you just can't staff up to those levels. You got to be able to make use of everyone we have working in the system.
Well, as you know, probably two of the main complaints were the lack of face-to-face communication, and secondly also the amount of time that elapsed between somebody filing and somebody seeing whether or not they got assistance. Are these going to be improved, do you believe?
Well, definitely, and that's one of our goals. I mean, that's what's been driving this. We have Secretary Murphy's gone all over the state and met with advocates, clients, and our employees. We've started an email address, hybrid input at fssa.in.gov. We've received hundreds of emails and hundreds of letters from people giving us their suggestions and sharing their experiences with us. And so we're collecting all of this data in order to develop our new system.
Jennifer, let me go to you. From your perspective and what you're seeing, what would you like to see improved with FSSA?
Well, for our specific office, in order for us to qualify a family for any of the programs we administer, we also have needs that relate to the FSSA office. And so for us, it's quick access. It many times prevents someone from actually getting into a situation where they may need the kind of assistance that they end up being placed in homelessness because they cannot access services fast enough. And they're coming to our office, and there's very little we can do. When we are at full capacity to assist families, we're essentially at a loss. And so once we have a vacancy or a place for a family, we need to be able to access information from the state if in fact they are being served by the state quickly. And at times that's been a challenge for us.
Marcus, would you like to respond to that?
Well, I mean, not knowing what circumstance specifically, I do know that the state does have certain limitations, and a lot of providers have all around the state. We've heard the same thing. We do have certain privacy regulations that sometimes it is difficult unless a provider or an advocate is an authorized representative for us to be able to give them information on an individual that they might be trying to assist. And so, one of the things moving forward with the new hybrid system that's been discussed is having specialized teams of people to work in the counties with the social safety net that's in that county to make sure that we have all of those connections and we can make sure that all the individuals have the authorization necessary to be able to get that information quickly.
Okay, one of my questions is, what now though? What specifically right now should we be doing?
I really hope we don't dwell too much on that FSSA makeover, but one of the things that's really critical in this is to come and talk to the people in the field. One of the reasons for the failure was there was no input asked from the local providers at all when these decisions were made. It's true, there's efficiencies that you can find, but you can't fund social services on the backs of employees being maximized on their output. You actually have to, at some point, start putting more money into services. I believe the 30% number, I believe that very wholeheartedly. We're seeing a tremendous increase in clients, but just to say, well, we're going to keep what's good and throw out what's bad without putting more money in just means we're going to be seeing more people and less benefits overall, the average. So I think we really need to focus on it's not just what happened, it's how we address it in the future.
We're going to get to more of this in just a minute.